You know, we always acknowledge our losses, but today is a milestone in America. We mourn 200,000 dead of the coronavirus, of our brothers and sisters, mothers and fathers. I just want to start with a moment of silence for the victims and their families. Thank you. And to the hundreds of thousands more that are still recovering, we wish them well. While some recover quickly and easily, others have an arduous process of weeks or months as they regain their health. Before we continue with today's update, I want to turn it over to our Lieutenant Governor to give a Native American greeting. We're going to be giving an update, among other things, on the impact of COVID in our Native American communities.
So good afternoon, everybody. Thank you, Governor. In the spirit of healing and education, we want to acknowledge the 48 contemporary tribes with historic ties to the state of Colorado. These include the Ute tribes, the Cheyenne and Arapaho nations, and many others. These tribes are our partners. We acknowledge their tribal sovereignty and respect them as tribal nations. We recognize these indigenous peoples as the original inhabitants of this land. So now I'll give it back to you, Governor.
Thank you, Lieutenant Governor. 654 positive cases in Colorado today. This is really an important update. You're going to get these numbers from Dr. Herlihy, our state epidemiologist, later. But we are seeing two things. One is significant outbreak among 18 to 25-year-olds, namely college students, and the bulk of whom attend University of Colorado Boulder, but there are a couple other universities that also have alarming info. There are other universities that have been able to have next to zero or zero spread of the virus. So we know it can be done. We know it isn't easy. We also know that there's a much lower hospitalization rate of the 18 to 25-year-olds, likely in the 1% to 2% range. Although, as I said to some student leaders the other day, and obviously a lot of this is about peer behavior and modeling, and it's important that the students themselves reach out to one another and act responsibly. You know, while 1 or 2% hospitalization rate is certainly far below the hospitalization rate for someone of my age, which might be 10% or so, somebody of Lieutenant Governor's age, which might be 25, 30%. And so it's really how it affects you depends on age. But even 1 or 2%, as I was telling these students, you know, that means if people are careless and go to a college party, you know, with 100 people, and it goes from one person to 80 people, as this virus would do, and in that kind of intimate environment with alcohol and close proximity, it's very likely that 1 or 2 people who attended that party will be in the hospital a week or two later. Most will make it out, but it's unpleasant. They could be in the hospital for days or weeks. And the fact that even somebody in their prime and young and healthy at a college party one evening, you know, 120 people at a party having fun, that's a big price to pay to have 1 or 2 that require hospitalization a couple weeks later. Now, the other thing we're seeing, and this is even more alarming, given the impact of the virus on people that are older than that 18 to 25 range, is there's also been an increase in over 25 across really every demographic, not necessarily related to the campus outbreaks, just a general increase. This is a warning sign for us, just as we had a warning sign in July, and we were able to correct course. This is a warning sign for all of us that, again, while generally what we're doing is working, we need to do it a little bit better. We need to be a little better with the mask wearing, avoiding large groups, being smart, being careful, right? Not being fearful, not being anxious, just being cautious, smart, careful. You know how to do this by now. I've you know, not just said it myself a number of times. You've hopefully read it in trusted publications and media. Wearing masks around others, staying at least 6 feet from others whenever possible, washing your hands regularly, avoiding large groups, keep it to 10 or less, right? Avoiding parties, avoiding large groups. This is how we contain this thing. And I think the message today is we're not, once again, and there was a period in July where we faced this, we're not doing quite well enough. We need to do a bit better, and that's for the next several months, right? We there already are some promising therapies. There's vaccines being tested. It's not forever. We can all live fulfilling lives. We go to work. We go out to eat. We hang out with a couple friends. But it just means, instead of 30 friends, you hang out with 3 special friends, right? Outdoors where possible instead of indoors. Today's the first day of fall in Colorado. Traditionally, a month or two of some of our very best weather for being outdoors. Let's let that wonderful Colorado weather be a weapon for us against the virus, which spreads more in indoor environments with limited circulation. So if you're going to associate with others or hang out with others, better to do it outdoors. Best to be outdoors when you can. We all have to be indoors. Many of us work or go to school, and I have meetings indoors too. Masks are very important, and then distancing where possible. And we'll get through this. So it's really a challenge based on the data that Dr. Herlihy will present to you. Let's step it up. Let's step it up over the next couple of weeks. Let's not have a big third wave of this here. Let's stamp this out. The college situation is one thing. Where the health risk for the 18 and 25-year-olds is less than it is for older Coloradans, and the institutions are working with their county health departments to take the steps they need to contain the spread at the campus level. But most importantly, it's on us. It's on us whether you're a 19-year-old student at CU Boulder, whether you're a 72-year-old retired Coloradan, or whether you work every day in downtown Colorado Springs or Denver. It's on us. And we need to step it up a bit to continue to make sure that Colorado is a reasonably safe place to live and work and play during the biggest global pandemic in a century. We are now at 66,000 cases. We have lost 1,926 Coloradans due to COVID. And the general trend has been an increase in COVID in our state. In fact, 12 of the last 14 days, and hospitalizations, 8 of the last 14 days have gone up. Again, you will see less hospitalization from that 18 to 25-year-old group, so we're grateful. The danger is the community spread. We know that college students generally associate with one another, but many of them have jobs or work in the community. We're particularly concerned if they work in food services or retail, encountering many others. Hence, again, the supreme importance of mask wearing, both for those working in stores and restaurants, as well as for patrons in stores and patrons in public areas of restaurants. Obviously, when you sit down at a table, preferably outside where it's safer, you obviously can take your mask off to eat. So let's get through this. Let's step it up. I know we can do it. I know we're all tired. We're tired of the virus. The virus is not tired of us. I'm confident we're past the halfway point on this terrible, challenging time, but it ain't over yet. Let's step it up. Let's save lives. Let's keep our economy growing. Now, as we've seen in a number of areas, the pandemic is magnifying some of the existing inequities in society. And one of those is the impact the virus has had on our American Indian and Alaskan Native populations. Now, that is both here in the Denver, Colorado Springs area, where we have tens of thousands of Native Americans, also in our tribal nations, and I will be in southwest Colorado in the next few weeks discussing the particular impact on our areas. Nationally, American Indian and Alaskan Natives have been disproportionately affected by both hospitalizations and deaths. So if they're experiencing 5 times the hospitalization rate, 40% more deaths than Caucasians. As an administration, we're doing everything we can to reduce these inequities. The majority of American Indians in Colorado actually live in urban areas. So they live in the Denver, Colorado Springs, Boulder, Fort Collins, suburbs, exurbs. And our Department of Public Health and Environment partners with the Denver Indian Health and Family Services to provide free testing for the Native American community. To give an additional update on these efforts, I'm turning it over to Lieutenant Governor Dianne Primavera. By statute in Colorado, the Lieutenant Governor of Colorado is the chair of the Colorado Commission on Indian Affairs. And in her time as Lieutenant Governor, Dianne Primavera has jumped into that, taken it extremely seriously, visited our tribal nations many times, been to powwows before the pandemic. I went to one. I think she's been to a couple and was able to partake in the congregation of people from tribes across the American West. We're thrilled to have with us Lieutenant Governor Dianne Primavera.
Thank you, Governor. Well, first of all, I want to acknowledge, and I'm really happy, that Lucille Echohawk from the Colorado Commission of Indian Affairs at-large board member and the former executive director of Denver Indian Family Resource Center has joined us here today. It's great to see you. We also have Adrianne Maddux, executive director of the Denver Indian Health and Family Services, joining us today. And it's my understanding that Rick Waters, who is the executive director of the Denver Indian Center, was here earlier but had to leave. At the beginning of 2020, no one imagined the impact that COVID-19 would have on our lives. The pandemic presented unique challenges, and it exposed and exacerbated existing disparities in our society, including disparities in our healthcare system. As the governor said, the American Indian and Alaska Native communities have been disproportionately impacted by the pandemic and its cascading effects. In response, the governor and our staff moved quickly to strengthen lines of communication with communities across the state. I've been convening regular meetings with the Ute Mountain Ute and Southern Ute Indian tribes since the onset of COVID-19 in Colorado. My staff and I have also met regularly with frontline organizations serving American Indian and Alaska Native communities living off tribal lands along the Front Range, including the Denver Indian Health and Family Services, Denver Indian Family Resource Center, the Denver Indian Center, Spirit of the Sun, American Indian Academy of Denver, Four Winds Indian Council, Native American Services Outreach at Colorado Coalition for the Homeless, and the Denver Public Library. This regular communication has been and continues to be crucial in identifying valuable opportunities for partnerships amongst these organizations and with state agencies to support our COVID-19 response efforts. It's also produced unique solutions with other partners across our state and helped identify and address barriers to service. For example, the Colorado Department of Public Health and Environment has partnered with the Denver Indian Health and Family Services, as the governor said, to provide free COVID-19 testing for community members. The Denver Indian Health and Family Services provides culturally responsive care for American Indians and Alaska Natives and is the only urban Indian health organization in Colorado. Additionally, the Colorado Department of Public Health and Environment has partnered with the Denver Indian Center to form a COVID-19 Native Response Team. The Denver Indian Center is an urban cultural gathering center for the American Indian and Alaska Native community of the Denver metro area. The COVID-19 Native Response Team is made up of community members who've been trained in crisis counseling to provide resources and mental health triage. The Colorado COVID-19 Relief Fund, used to assist and any nonprofit, school district, municipality, tribal organization, or business is helping our most vulnerable being impacted by COVID-19 and has granted $165,000 to several American Indian and Alaska Native organizations, including the Denver Indian Center to support their food bank and operations, the Denver Indian Family Resource Center helping to strengthen Native families by providing assistance with COVID-related needs depending on the needs of the individual or family, Four Winds American Indian Council and their food bank, and Herbal Gardens Wellness supporting Native communities. Within my office, I directed the Colorado Commission of Indian Affairs to reorient the Health and Wellness Committee to focus on addressing the impacts of the COVID-19 pandemic in the community. We convened state agencies, non-governmental agencies, and American Indian and Alaska Native community members to identify strategies to support the community. The committee prioritized developing culturally responsive public service announcements and other materials to help educate the community on COVID-19 testing, hand washing, face coverings, which the governor and I are wearing, and the importance of mental and behavioral health care. Adrianne Maddux, Executive Director of the Denver Indian Health and Family Services, and Catherine Redhorse, Executive Director of the Colorado Commission of Indian Affairs, co-chaired the committee, ensuring that these efforts were Native-led and Native-designed public education campaigns. I'm excited that Adrianne Maddux is joining our press conference this afternoon, and for her to tell you all more about the amazing services that the Denver Indian Health and Family Services provides to community members. So I look forward to continuing our conversations and identifying innovative partnerships to support the incredible work that these organizations are doing. Adrianne, I think you're up.
Sorry, I was struggling
That's
with my
okay.
mask.
They're tough.
Thank you for the opportunity to speak today about the impact of COVID-19 in our American Indian community. I am the Executive Director of Denver Indian Health and Family Services, and I'm also an enrolled member of the Hopi tribe in Arizona. Denver Indian Health and Family Services' mission is to provide culturally competent services that promote health for our American Indian Alaska Native families and individuals in the metropolitan Denver area. We are one of 41 urban Indian organizations across the United States funded by Indian Health Service. We were established in 1972 following the termination era by Congress to fulfill the federal government's health care related trust responsibility for Indians who live off reservations. Today, more than 70% of Native people live in urban areas. Our clinic provides primary care, behavioral health, dental, pharmacy, enrollment services, and diabetes prevention and management. We have over 7,500 registered patients in our database. Through September 2020, we have tested 443 individuals for the virus and 15 were positive. Colorado Department of Public Health and Environment reported through August 2020 that there were 294 American Indian deaths and 19 were related to COVID-19. Our population continues to die at higher rates than any other Americans in many categories, with the higher rates of diabetes, heart disease, and other chronic conditions. Our community faces an increased risk of severe health complications due to the virus. Across Indian country, factors such as food insecurity, fresh water, lack of access to health care, and struggles of obtaining the proper PPE to provide services to families that need it have been lacking, and our communities have been underprepared and devastated. So I want to express my gratitude to partners that have provided direct support to our organization throughout the pandemic. Colorado Commission of Indian Affairs, Denver Indian Center, Denver Indian Family Resource Center, our state tribal liaisons, Project Mosaic, and along with other agencies such as Lockheed Martin, whom Lieutenant Governor Primavera connected us with, and our relationships with Direct Relief, Project Cure, Indian Health Service, Colorado Department of Public Health and Environment, Denver Public Health, and the Colorado Safety Net Collaboratives for donating essential PPE, which allows us to keep our frontline workers safe so that we can continue to take care of the families that we serve. The pandemic has profoundly impacted individuals across Indian country. The CDC released a study that examined how the pandemic affects American Indians, which are at the highest risk of the disease. CDC found that in 23 selected states, cases among the Native population were 3.5 times that of non-Hispanic whites. The Colorado Commission of Indian Affairs COVID-19 Committee teamed up with Project Mosaic to form a campaign that included the Ute Mountain Ute Tribe, Southern Ute Tribe, and organizations that serve the Native American community. Project Mosaic is a Native American-owned and operated consulting group who helped us strategize a communication approach in a coordinated manner. And that was to reduce mistrust and fear, build community, leverage cultural strengths, and promote healthy norms of behavior consistent with Native American culture. Our partnership organized and launched a campaign to inform individuals of COVID-19. The committee created 5 subcommittees that included communications, data gathering, basic needs, education, health, and mental health. The priorities of the subcommittee were to create a branding approach in a CCIA branded mask, which we're all wearing today, and 10 infographics designed by Walt Poyer of Nakota Designs. To produce a PSA showing the ease of COVID testing at our clinic, and to explore the feasibility of a 211 hotline specifically for the Native community. As we navigate this pandemic, we will continue to address COVID-19 and to keep our families safe and informed. As a co-chair of the Colorado Commission of Indian Affairs Health and Wellness Committee, I express my most profound appreciation to Governor Polis, Lieutenant Governor Primavera, Colorado Commission of Indian Affairs, our tribes and community partners for their participation in this extraordinary campaign.
Thank you, Adrianne. You know, this virus affects everybody as part of that. You know, Native American, Black, Latino, Asian American, white, whether you live in Sterling or Montezuma County or Fort Collins. It's here, it's in our community, and we need to be smart to avoid additional fatalities, to be able to move forward with building back and growing our economy. And most importantly, to prevent additional loss of people that might be close to you. It could be your own brother, sister, aunt, or uncle, mother, or father. It could even be your own life that you save by avoiding large gatherings, by wearing masks, and being careful and being smart in these next few months. I know this takes a tough toll on all of us. Some that means a tough toll economically. Others have their jobs and are doing fine. Some it means a tough toll psychologically, spiritually. Humans are a social animal. We love to be together. And we can, in many ways, be together carefully in this pandemic, going camping a weekend with one other family or having a few people over, 3 or 4 people for dinner. But we really have to avoid those large gatherings. We'll be able to, of course, resume them with gusto at some day in the future. But in the meantime, we want to make sure that you're there, I'm there, your loved ones are there to celebrate that day. Now, I want you all to see the same data that we see. Dr. Herlihy, our state epidemiologist, will provide an update on the latest information so you can see these trends in Colorado. I fully trust you to react accordingly, to be smart, to be safe, but I want you to have really all of the data every day that we use for decision making is at covid19.colorado.gov. But Dr. Herlihy has prepared a few highlights so you can see exactly where we are with regard to the fight against the deadly virus in Colorado. Dr. Herlihy.
Thank you, Governor. Good afternoon. Next slide. So as I shared with you last week, we were seeing a gradual increase in cases in the state. And you can see that represented on this figure. The last 2 weeks, you can see we saw an increase of 2% and 6% week over week. Again, if you look at this figure, the weeks where we see an increase are shown in red. The weeks where we see a decrease are shown in blue. What you can see for this past week, though, however, is a very substantial increase, an acceleration of disease transmission occurring in the state, as represented in this figure. Next slide. And as the governor explained to all of you, we know that much of this disease transmission is occurring among 18 to 25-year-olds and is occurring among college students. But we know that's not the entire picture. But I think it is important to acknowledge here that we are seeing really that rapidest increase among those 18 to 25-year-olds. And that's really been for the last 2 weeks in the state. Next slide. However, if you look at cases in the state excluding 18 to 25-year-olds, you'll see that even among other age groups, we're again seeing rapid acceleration of this virus in the state. So you can see week over week, we saw a 45% increase in cases last week. So that's certainly a very concerning trend for us. So as I mentioned, the greatest rate of acceleration is in 18 to 25-year-olds, but in all other age groups, we're also seeing a level of increase at a pretty rapid rate. Next slide. So one of the things that we do to evaluate how much of our increase is due to increased testing is to track percent positivity. So the good news in this figure, if you look at the most recent week, you'll see that we did substantially increase the amount of testing that's occurring in the state. And so that's certainly great. We're working closely with our college university partners and with our local public health agencies to make sure that students on campus have access to testing, and that, of course, Coloradans around the state of all age groups have access to testing. And so in the last week, we have been able to increase testing in the state. But if you look at the red and blue bars at the bottom here, you'll see that at the same time, we have seen an overall increase in our percent positivity. So in the setting of increased testing, when we see an increase in percent positivity, that's an indicator that we are seeing a true increase in the amount of disease transmission that's occurring in the state. Next slide. As the governor mentioned, we recognize that 18 to 25-year-olds are much less likely to be hospitalized. We certainly do see hospitalizations among that population. So thus far, we have really seen a relatively stable trend in our hospitalization data. So that 7-day average has minimally changed in the last week or two. And we certainly hope that continues. But we do know that hospitalization data can lag behind some of our case data. So this is certainly a trend that we're going to be paying close attention to over the next couple of weeks to see if, as we see additional transmission potentially outside of that 18 to 25-year-old population, could we see a spillover into other age groups and potentially an increase in hospitalizations in the state. Next slide. Wanted to share some age-specific trends with you. So I shared this data with you last week. One of the things that we're highlighting here is obviously the substantial increase that has occurred among 18 to 25-year-olds. That's shown in the lightish green colored bar that is really at a much higher rate of disease transmission than the other age groups. But I think it's equally important to recognize that we are seeing an overall increase in all age groups, and that's what that figure shows you. So obviously the most substantial increase occurring among 18 to 25-year-olds, but increases occurring among all age groups in the state right now. Thank you.
So, look, what can you do? In addition to being smart and being safe, wearing a mask, avoiding large gatherings, washing your hands, if you have symptoms, if you have a sniffle, a cough, a fever, get tested. It's free, it's quick, it's easy. There's over 50 sites across the state, covid19.colorado.gov. Some of the free, quick, and easy sites in major metropolitan areas include the Aurora Sports Park, Water World in Federal Heights, Pepsi Center, Citadel Mall in Colorado Springs, Pueblo County Fairgrounds, Mesa County Fairgrounds. There's 2 in Boulder, Stasio Fields, and 1 on the Hill. Walk in, one of them's drive-in. You're done in 15 minutes. Free, quick, easy. Get the results in a day or two. Really important to for us to be able to contain the virus, and for you to know whether in fact you might be a deadly threat to your own housemates, friends, neighbors, or family, or whether it's simply a passing cold. So if you're experiencing symptoms, get tested. The testing isn't limited to those with symptoms. If you think you were exposed a week ago, again, it doesn't do any good to go in a day or two after you're exposed. You don't have it yet. But if somebody coughed on you, a loved one had it, you think you might have been exposed, you go in 7 or 8 days after the exposure and get tested to see if you've contracted it yourself. Before we close, I just want to talk a little bit about housing and some of the recent steps that we've taken to ensure Coloradans are stably housed during the pandemic. We created a eviction prevention task force, and they've met twice already, making recommendations to discuss the new CDC federal order, recommendations for Coloradans, next steps to keep people housed. In light of the recent federal notice on evictions, what we did today is we amended an executive order to include a notice requirement that makes sure that tenants are notified of their rights under the CDC anti-eviction order. So there's a notification piece of that landlords will provide to tenants in our state. Since launching 2 programs that help people with financial need due to COVID-19 pay their rent or mortgage, we've given $7.49 million out in rental and mortgage assistance. The HelpColoradoNow.org COVID Relief Fund, which has raised over $20 million, has also prioritized housing assistance through community partners across the state. Last Friday, through our property owner preservation program, where landlords apply on behalf of their tenants, the Division of Housing distributed $5.2 million to more than 4,000 households to allow them to stay safely in their home and not be evicted. And through our emergency housing rental assistance program, we distributed $2.36 million to over 1,000 households. So a lot going on. No doubt a lot more. That's why we convened the task force. The notifications will help. The additional aid will help. But we of course, extend our sympathy not just to the families of the victims of the virus, but to the victims of the global recession that has also occurred in the wake of the greatest pandemic in a century. Thank you for joining us today. Be smart, be careful. Let's do a little better, Colorado. And happy to answer some questions.
Go ahead.
Governor, earlier this month we saw there was an economic forecast that said things were looking good for the state and that we wouldn't need cuts. Now we know that furloughs are planned. Can you tell us why now, and do you know exactly how much you'll save because of this?
Well, I appreciate your optimism that there was somehow a forecast showed there wouldn't need to be cuts. The forecast showed that there needed to be billions of dollars in cuts, both the legislative forecast and ours. Very tough budget year, this year and next year. I think what the glasses half full was it wasn't the worst case scenario that people were worried about. We are seeing a recovery, but our unemployment rate is still, I think, 6.7%. It was in the twos before the recession. So we absolutely, it's a time for belt tightening, and families are tightening their family budget. Many folks have lost hours that they work. Others are worried about losing their jobs. There's more Coloradans unemployed. The public sector, too, needs to tighten its belt to get through this. And we extended that furlough program today as a way to save millions of dollars of taxpayer money and make sure that we can minimize interruptions to important state services.
David Clue over at Denver 7. Given the sharp rise in the number of COVID cases in Boulder County, the majority of the cases you mentioned are connected to the university, and given the huge impact it could have on businesses that are doing the right thing in Boulder County, what can or will the state do in response?
So right now, there's not yet evidence that the student outbreaks have led to greater community-wide outbreaks. That is at the top of the list of our concerns because we know that while college students are generally part of the campus environment, many of them do work in the community. We want to make sure that no person in Colorado, but particularly where there are outbreaks like at CU, go to work if they are exhibiting any flu-like symptoms, particularly in retail or food services, get tested. We've worked closely with CU and Boulder County Health to step up testing with both the testing that the university is doing in the dorms, as well as the two free, quick and easy sites in Boulder so that people can immediately be identified and, if necessary, quarantined. So I think it's really important that every college in our state take this seriously. Many are doing well. We have next to zero cases or I think zero in the last week at Fort Lewis and Durango Residential College, very few at UNC and Greeley. Last I checked, our entire community college system with 120,000 or so distinct students, not all of them full-time, only had 6 cases as of last week. So we know that it can be done, and we look forward to working with University of Colorado, their president, their chancellor, and their regents to help contain the outbreak before it spreads to the broader community, both in Boulder County as well as across the state.
Another question on the furloughs. The JBC says it wasn't aware that these furloughs were coming until it actually saw the CBS 4 story. I was wondering why you didn't alert the JBC before you took that move. And then the other question is a state employee reached out to us and questioned the legality of the furlough scale, saying that essentially it has to be equal among all state employees as opposed to the salary scale that your administration has put forth. So I was wondering if you could address both of those.
Well, there have been furloughs in the past. This is actually it's my understanding this is the shortest furlough of the furloughs that have been done. What we are essentially doing for those who are watching, and I'll get back to the specifics of your question, but essentially the day after Thanksgiving, That's the Friday after Thanksgiving. The state will be closed, except for the clearing snow if needed and law enforcement. But the people that work every day, Sundays and Christmas Day, are of course working. But generally speaking, that furlough day will be the day after Thanksgiving. What the other piece we were doing is that higher paid state employees are taking additional furlough days, up to I think 4 furlough days for those making 140,000 or more, maybe 3 for 90 to 140. I don't have that in front of me. No one is taking more than 4 furlough days, and only a small fraction of the state workforce is taking that many furlough days. So, of course, it's been vetted legally. It is a compassionate way to do a furlough because nobody who makes less than $50,000 that works for the state of Colorado will have to take any unpaid days, and those who make more than that will have a small amount of unpaid time, a day or 2 or 3, for a few cases 4. And the biggest day will be the day after Thanksgiving, where state employees will have a longer period of time off, Thanksgiving through the weekend.
Hello, Governor. This is Vinny Del Giudice at Bloomberg News in Denver. 200,000 COVID-19 deaths nationwide. You talk to the White House on a regular basis. If you told the president or the vice president you bungled it, you let the nation down, any criticism? Thank you.
Well, today I think is a day of mourning, a day of reflection. It's not my role as governor to engage in political punditry. I think what's clear is that America could have done better. That's not just a hypothetical statement. Many other nations have done better. How have they done better? Less deaths per capita than America, which is tragically one of the top countries in the world in deaths per capita, which is why today we're mourning the loss of 200,000 people. There'll be plenty of time for a post-mortem to better prepare America for what lies ahead. I think there needs to be a solid, science-driven process about how to better prepare our country as a nation in this regard. I, from the start, have been disappointed in the lack of a coordinated national strategy to defeat COVID. We've had 50 different states all on their own, occasionally receiving support from the federal government, but each having to develop their own testing supply chains, mask and gown and glove supply chains, expertise. And Colorado's rising to the challenge. Our residents are rising to the challenge. But I hope that we take this as a moment of reflection to really make sure we redouble our efforts in the weeks and months ahead to make sure that we don't have to mourn another 200,000 or another 100,000 after this great period of loss.
From Fox 31 here. Question for the governor and Dr. Herlihy. Today, the CDC released guidance when it comes to Halloween, recommending that people don't trick-or-treat or wear masks. What's the guidance here in Colorado, and is there a concern about people going out and gathering in that way?
I have not seen the CDC guidance. We encourage people to reduce their interactions with others. If there's a need in Colorado, we can work to provide that guidance. I think there's probably a safe way to do that, where rather than the face-to-face interactions, there's candy that's left at doors, and if there's demand, we can do that. We're happy to look through the CDC recommendations. I'll go to Dr. Herlihy on that.
Yeah, absolutely. So that guidance is new to us too. We're reviewing that guidance now and trying to come up with some strategies for Colorado that make sense. We know that there's obviously going to be some challenges and that Halloween's probably going to look a little bit different this year, but we certainly want children especially to be able to celebrate in a safe way.
Hi, this is Claire Cleveland from Colorado Public Radio. What's the state anticipating in terms of flu season this year, and what plans are in place to deal with flu and COVID-19 simultaneously? Thanks.
Yeah, and I'll have Dr. Herlihy give an update on the state's extraordinary work to improve our immunization rate for flu. I would simply indicate that the same social distancing strategies that are effective in containing coronavirus are also expected to be effective in reducing prevalence of the flu in Colorado. And with that, I'll turn it over to Dr. Herlihy.
Thank you, Governor. So really two strategies, of course. The first is, the same things that we're doing for COVID-19 right now to reduce transmission, we know will be effective in limiting the transmission of influenza. We've seen pretty good news coming out of the Southern Hemisphere so far about influenza transmission. I'm certainly hoping that will be the case here in the U.S., but obviously vaccination is going to be a really important part of that strategy, and we really want everyone over the age of 6 months to receive their influenza vaccine this year. It's a strategy really for all age groups, not just to protect yourself from influenza, but to protect your community, to protect your seniors that live in your community and other people that might be especially vulnerable to severe influenza illness.
Rachel, I haven't gotten my shot yet, but I plan to in the next week or two, and I'll make sure to live cast it. Diane, have you gotten yours yet? October's better. Rachel, have you gotten yours yet?
Not yet, but I certainly will be soon, and I'd say any time is the right time.
Yeah, and I think is it fully available in the communities now, or is it just coming online?
Certainly we're hearing about increasing availability in the state.
Yeah, so it was available early in some of the national pharmaceutical chains a couple weeks ago, and I think it's now reached hopefully all the community health clinics and others that can administer that, and I encourage all Coloradans to increase their protection. Anybody there?
Hello, Governor. Can you hear me?
Oh, who was that? Go ahead.
I'm Jesus Roquel from Noticias Univisión.
Sí.
Gobernador, hoy es el Día Nacional de Registrarse para Votar. ¿Qué información y cuál sería su mensaje a la comunidad latina de la importancia de registrarse para votar y las votaciones?
Sí. Hoy es un día de recognición para registrar para la vota. Tiene más tiempo para registrar, pero ¿qué día es mejor que hoy? Debe ir a el sitio del red. What is it? ¿Qué es el sitio, María? Momentito y voy a repetir la contesta. Let me ask Jesse's question and then I'll get back to yours. Go ahead.
Dr. Herlihy, this is actually for you. I'm wondering if you can put in perspective how significant this increase in cases is compared to the one that we saw in June and July. And, just from the graphs that you had, it looked like this one is more steep and maybe more worrisome.
So it's actually fairly similar to what we saw around the 4th of July holiday. So if you look at that time period, I was around 45%, I think, week over week increase. I want to say we were in the low 50s this past week for all age groups. But if you look specifically excluding the 18 to 25-year-olds, so that contribution of college outbreaks right now, it is in the same 45% range.
Momentito. ¿Qué día es mejor que hoy para registrar para la vota? Hoy es un día de recognición nacional para su voz, su vida, su vota. Y es importante registrar. El sitio de la red es govotecolorado.gov. govotecolorado.gov. Tiene más tiempo, sí, para registrar, pero ¿qué día es mejor que hoy? El primer día de otoño es el mejor día de registrar para la vota.
Governor, this is Chris Vanderveen, reporter at 9 News. I want to ask you a question about the vaccination process, and I know we're still maybe a ways away from that. I want to get a better idea. Do we have an idea on how rollout might work in the state of Colorado? Who might move to the front of the line? What this might look like? Again, I know it's September, but are we getting a better idea of how this is going to work? Because there's lots of sort of rumors and thoughts about how this is going to work flying around there.
Yeah, and I'll give it to Dr. Herlihy to give a timely update. I think what we would also like to do is provide a more comprehensive update at some point in the next week or two on this topic before it becomes live, which we hope is as soon as possible. But I think the most optimistic scenarios for when this will be a question on the ground is November and December. And of course, as you indicated, the supply of vaccine, if one of the ones tested demonstrates safety and efficacy, which we're hopeful will occur, there would be limited availability in November and December. And so in broad strokes, and I'll turn it over to Dr. Herlihy to talk about the process, and we'll be happy to give a more comprehensive view, including from members of the GERC that are directly involved with this. But the general broad view is first responders and those who are exposed to others every day, like nurses and others, law enforcement, and those who are most vulnerable, meaning those who have a 25% hospitalization rate, versus a 2% hospitalization rate, namely people in their 70s and 80s and 90s, people with pre-existing conditions, and others who might be at greater risk. I'll turn it over to Dr. Herlihy to talk about the process, and we'll be happy to give a more comprehensive transparency into that process in the next week or two. Dr. Herlihy?
Sure, thank you. Happy to go into more detail in the future. So, in short, we are both looking to federal guidance for how to prioritize populations to receive the vaccine in what order and what the timing might be. But as the governor mentioned, also working here in the state to make sure that we have priorities identified here in the state for how to best proceed with ensuring that our frontline workers and our most vulnerable populations are really protected early on, knowing that then there would be a second phase to try and really make sure that individuals across the state can receive the vaccine in all age groups and all risk strata.
And part of this is contingency planning, because you don't yet know whether that number in, let's say, the first week in December is 100,000 doses, 300,000 doses, 5,000 doses. So it's a way to kind of build that prioritization about how to make sure that whatever limited capacity we have to increase immunity, and I think it's important to say increase immunity, not make people immune. Obviously, in a wildly optimistic scenario, one of the vaccines would have a very high immunity rate, but generally speaking, the FDA has said they will release it if it's in that 50 to 70% increased immunity range, which from a public health perspective would be very beneficial, but still means, of course, that there's risk of contracting the virus. There's also hope that, as is the case with the flu vaccine, that those who are immunized would have a lesser symptoms and a less dangerous manifestation of the virus if they were to contract it. So that's another hope that is out there, not validated, unknown, but a potential upside that we've seen with other vaccines.
Hi, Governor. It's Ed Seelover with the Denver Business Journal. I want to go back to the furloughs real quick. Could you tell us how much money you believe you can save with this proposal? And also, is there a particular area you want to put that money to, whether it be repaying a Tabor Emergency Reserve, education, or a specific program?
So we'll be happy to get you the specific dollar amount. We do have that. I would just say that money in the budget is fungible. So, I would just say within the realm of state employees, we felt that as painful as it is, a furlough is preferable to layoffs or to cutting back on necessary government services. So we felt that it was the best path, and we'll be happy to provide you the exact dollar amount of that is saved.
Hi, this is Erin Prater with the Gazette in Colorado Springs. Just curious about this third wave. We know this sounds like partially due.
I'm sorry, we had trouble hearing you. Could you repeat the question?
Yes, can you hear me now?
Yes.
Excellent, sorry, thank you. This is Erin Prater with the Gazette in Colorado Springs. Just curious, this third wave that we're experiencing, it sounds like this is in part due to colleges, but we had heard before from Dr. Samet that a third wave may be coming after Labor Day due to decreased social distancing. Do we think this third wave is in part connected at all to Labor Day or to K-12 schools resuming in-person education? Also, do we have any idea about the percent of social distancing in the state right now and the R-naught value?
So some national projections of the R-naught value are very alarming. There's the RT Live projection of the R-naught value, which shows Colorado in the top 10 states of transmission of the virus. Now, the biggest factor in that are the 18 to 25-year-olds, which we view as a issue in its own right, but one that we don't yet have a demonstrated connection to community transmission. As Dr. Herlihy showed, the increase is not just attributable to campus experiences and 18 to 25-year-olds, however. The reason that we are more concerned is there is also an increase, similar to the one we saw after 4th of July, among the general public that are over the age of 25. We don't know the causality of that. It's certainly possible that Labor Day activities like 4th of July weekend activities led to an increase. The timing of those two is consistent. But we do not know from a scientific perspective the exact cause. I think what's also certainly a possibility as time goes on is that Coloradans reduce their caution. And this is a message that now is not the time to do that. Any decrease in social distancing or mask wearing would be to the benefit of the virus in being able to take the lives of more Coloradans. So it's very important that we redouble our efforts. We're all tired. We all want to get through this. I think we're past the halfway point. We're not yet in the final sprint, but we're getting to the. We'll use a football metaphor. We're in the third quarter here. We want to be able to continue really the leading role that Colorado has had in this regard. Dr. Herlihy, would you like to address that from a number and epidemiological perspective about kind of the comparison between 4th of July and Labor Day and what you see?
Yes, thank you, Governor. So that was a great response, actually. I mean, I think that's pretty much exactly what I was going to say. As far as the numbers go, we estimate that the effective reproductive number is just above 1 right now. We estimate that our social distancing level is probably in the 60 to 65% range. We know that that's a place where we could continue to see growth in the state. It's actually still a little bit higher than what we saw for 4th of July for our social distancing estimates, but I think it'll be interesting to see as time tells, especially as we see potential impact on our hospitalization, which we know can lag, if that number might change in the next week or two. So we're closely monitoring that. As far as the number of cases and the rate of increase, that does look similar to the 4th of July. So I think lots still to learn and lots to, I mean, I think we still need to really closely monitor the data for the next week or two to see if this overall impact is going to be similar to the 4th or perhaps different.
So, there's different ways to analysis. And this is, we obviously report everything we have and you see it. And, some say, well, should we look at the college outbreak separately and say, well, that's not really community spread. And so does that mean things are safer or not? Or do we include them in the total? I think the one thing that's clear is the more community spread there is, the more site outbreaks there will be. And whether that's a college, which has a lot of people, whether it is a meatpacking facility, whether it's a high school, whether it's an office building, the more the prevalence of the virus in the state, the more of those site outbreaks will occur. Now, each of those sites has a different protocol around acting early. It's harder with a college than it is with 100 people in cubicles where they go online and virtual. Hopefully they've been telecommuting if they can this whole time. It's a community of 25,000 people. That's a challenge logistically to be able to orchestrate. The state health department has offered its assistance. The University of Colorado, Boulder County Health has as well. But the better that we can do across the entire community, the better that we can contain and reduce the number of site-based outbreaks across a broad variety of aspects of society.
Hi, Governor Polis. This is Liz Gilardi with Denver 7 News. You have mentioned that there is an increase in cases for college-age students, and specifically, as you were just talking about, Boulder. And I'm wondering, could the state take any additional action as it relates to Boulder County, specifically to curb spread?
Well, the health concern would be that the virus could spread to Coloradans that are at much greater health risk than 18 to 25-year-olds. With a 1% to 2% hospitalization rate, we are well within our hospital capacity with outbreaks in that younger population to be able to not compromise our quality of care for anybody that contracts coronavirus or needs hospitalization for any other reason. But the real issue is that we know that 18 to 25-year-olds don't live in social isolation. While presumably they predominantly socialize with people their own age, many do also have jobs in the community, work in food services, work in retail. And I would say we have a very heightened concern about that potential vector to transmission to Coloradans that might have a 20 or 30% chance of hospitalization rather than a 1 or 2% chance of hospitalization.
furloughs, just wanted to ask about the scale that you released. Did that take into consideration that some of these employees had already had to take cuts that were COVID related? And will you also be taking a furlough?
So, Lieutenant Governor and I, the governor's staff, all the members of my cabinet will be taking furlough days according to the same schedule as everybody else. This is a compassionate furlough model that makes sure that those who work for Colorado and earn under $50,000 a year have no furlough days, will have no loss of pay. And for many others, it's 1 or 2 days. There's a few of the very highest compensated state workers that would be receiving 3 or 4 days unpaid furlough. Thank you.